The first example for interconsumption is yang consuming the yin. As you can see on the first tower diagram, there is increase of yang or heat. This is heat because of exposure to heat over a period of time. So it is a natural reaction for the yin to increase at first because there is increased yang. After a short period, the yin will be consumed, so there will be dryness, loss of weight. This is deficiency of yin caused by exposure to yang factors over a period of time. These yang factors could be stress, exposure to excessive climatic heat or fever, excessive alcohol consumption. The body has to supply the yin from the interior in order to control the excess yang. After a point, it is only natural that the yin will be exhausted. So this will manifest symptoms like loss of fluid, loss of weight, malnutrition, or reduction of substance or structure. Clinically, there will be dryness, weakness, exhaustion or burnout, loss of weight, and poor endurance. Treatment: tonify yin, sedate yang. This is a subacute state where the yang pathogenic factor has made a lasting damage to the yin of the body. This is caused by a substantially strong yang or a longer period of disease, like high fever, prolonged and regular consumption of alcohol. What does yin deficiency mean? This means that much fluids, nutrition, and sleep are needed to improve this luck. And unfortunately, this cannot be substituted by anything else. The tonification with needles will actually help the body with absorption and distribution of nutrients and fluids. We can also improve appetite, digestion, thirst, and the quality of sleep with acupuncture. Let's go to another example. This time we have yang consuming the yin. Example 2. So we have a case of bacillary dysentery following food poisoning. When yang increases because of infection, the yin increases to contradict it. Hence, watery stools will follow. The infection is similar to a blazing fire where water is needed to extinguish it, and the body releases its fluid to control the heat. As the diarrhea continues, the patient becomes dehydrated and the stools become smaller and are accompanied by mucus. Sometimes the patients pass only blood as the body tries to eliminate heat by bleeding, as it is unable to balance the heat by increasing the yin. Blood not only circulates nutrients throughout the body, blood also circulates heat. If blood does not reach our fingertips, they would remain cold. But when there is too much heat in any part of the body and there is insufficient fluid to cool this heat, simplest way to reduce the heat is by dispersing the heat to the outside. So this is done very quickly and effectively by the body, by bleeding. Examples: nosebleeds, coughing blood in tuberculosis, vomiting blood in stomach ulcer, excessive bleeding, not clotty in menstruation, and hemorrhoidal bleeding. Treatment: sedation of yang, tonification of yin in the large intestine. Balance the fluids and salts with infusions if necessary. Excessive spontaneous bleeding shows two problems. There is too much heat or there is insufficient fluid. As long as the body has enough fluid, it will react with fluid, not blood. Now let's go to example number 3. This time we have alcohol intake. Alcohol increases liver yang. This is, I think, very common. Initially, the liver yin can increase So there goes your hangover. In due course, liver yin is consumed, causing symptoms of contractures of muscles and tendons, tremor, dry eyes, lack of control over anger. Deficient liver yin cannot control the rising liver yang. Liver yin stores blood. So when yin is deficient, there could be spontaneous and excessive bleeding, as in the case of liver cirrhosis. A reduced state of blood, and so we have another tower diagram which is showing to us the end result of excessive bleeding, like we'll have reduced state of blood and qi. Treatment: sedate liver yang and tonify liver yin. Points to hold the blood within vessels, and other points against alcohol abuse.